dentist tells you to look in a certain direction, we sort of assumed
Yep.
that that would be the path that one would be looking at. And to our surprise, of course, that was far from the truth.
Right.
They do what they do, and they're not looking at what the science says. And I think it's very, very important that we follow the science.
So in terms of how they try to pin you down and excise you from the profession, is it the case then that you're brought before a board and have to present your evidence?
Well, you will be. It is like any court.
Yeah.
But of course, lay people or even some of the dental profession. So it's not really set up in that way.
Right.
Where you get the charges, but there will be a set of charges that you have to defend yourself. So it is, you know, with a prosecutor and a defense, and that's the way it goes, like any court. And of course, when people go through that, then you tend to stick to what the mainstream way wants you to think, rather than stick your neck out, because it's of course very unpleasant having your livelihood taken off you for reasons like that.
They are coming at us again. We've been told that they will be taking actions against us. They will be for 2 years now, but as yet, they keep postponing it, but as yet no charges have been produced. So it reminds me of Kafka's The Trial.
Right.
They've told us a trial going up, but they won't tell you what the charges are. We don't know. But they said we're going to have a go at you, but we don't know what the charges are yet.
Yes, it's almost like the last episode of The Prisoner as well, for those who remember their 1960s TV shows as well, where the court is there and goodness knows what is happening. So in terms of this technique, I mean, is it something that any dentist could use if they were minded to? Is it extraordinary in terms of the technology used or anything?
Not particularly. You certainly need to have a background in the proper use of dental materials and surgery too. And it's a case of you have to be completely and totally thorough. If you're taking infections out of the bone, if you leave a tiny bit of the infection in the bone, it's going to come back. So it's one for the more pedantic minded, because you really have to be very, very slow and thorough in what you're doing. But the effects on people's lives are just so dramatic.
And I mean, we've got various illustrations, some of which I should warn our audience are quite gory and graphic, but I think we need those to actually make people aware of what we're talking about. And one of the most common fillers is actually mercury based. So how does this stand up? Because we know there are dangers with mercury, so surely that there isn't a danger from mercury in the form that it's being used in the fillings.
Well, I wish someone could explain this to me, because the amalgam fillings is what we're talking about, are 50% elemental mercury, and it's classed as a hazardous product before you place it in the teeth. And it's classed as a hazardous product when it's taken out of the teeth. But in the teeth, 2 inches from your brain, somehow it's safe. And no one's ever explained to me the logic behind that, because it doesn't make sense. And we know that mercury is constantly giving off the amalgam filling, and we know it goes to the brain. In fact, the science about mercury is so clear now that Professor Vimy at the University of Calgary said that anyone who says that the science of the pathology of amalgam isn't true is either a liar or incompetent. So if anyone says it's safe, you must ask them that, are you lying to me, or are you just basically incompetent?
And in terms of what the mercury is doing in your mouth, if we have a look at image 102, if you could talk us through 102 here in terms of what are we seeing here on this green screen?
This is how we could prove that mercury, in fact, was coming off a tooth. This was done when we were in America. What we did was we got a small rubber, as you would use for rubbing out a pencil mark, and we put it on a tooth. That particular tooth there is has a 25-year-old filling. We rubbed it with the rubber puts heat into the filling, and then mercury vapor comes off. We put it behind a phosphor screen, and you can actually see the...
And now if we move on to image 103, I think this one is the graphic depiction of what you've just described there.
Yeah, this is one that we did. This is a 22-year-old filling. So this has been in someone's mouth for 22 years before the tooth came out. And then we took a rubber and rubbed it for 10 seconds only.
Right.
And every time that person has a hot cup of tea or brushes their teeth, mercury comes off. And that's not a little bit of mercury, that's a huge amount of mercury coming off all the time.
So when you say a rubber, you're on about a sort of pencil eraser type rubber?
Just a small pencil eraser.
And it has that effect?
That effect.
Goodness me, goodness me. And there is also another side effect to these amalgam fillings with the mercury in. So if we have a look at image 114, now this is actually a tooth filled with this mercury product. But what's intriguing about this?
Well, that's a tooth, a molar tooth, and you can see the hole in it where we've carved away the amalgam. And if you look towards the left-hand side, you'll see the dark crack running through the tooth.
Right.
Because what happens to amalgam, as amalgam ages and the mercury leaves it, it expands. And because it's contained within the tooth, as the expansion cracks the tooth, so that tooth, the whole half of that has cracked. And so eventually that half of the tooth will fall off. And everyone you talk to has had an amalgam filling, has had a tooth break off. And it's due to the expansion of the corrosion.
Let's take another image on the same theme. This is 110. So again, this is, I'm taking this is another crack caused by...
That's before we've actually taken the amalgam out, but you can see the amalgam stuck within the tooth, it's expanded, and it's cracked the teeth. You can just see the black lines down, that tooth is cracked.
So, I mean, is extraction the only answer once that's been done?
It might be. It's quite tricky to say, but certainly if a tooth is badly cracked, the long-term viability is certainly suspect. You can hope by bonding the teeth together. There are various techniques where might rescue the tooth, but in the long term, the tooth is probably lost.
So if we look at image 107 now, can you talk us through what we've got here on 107?
Yes, we've taken out the amalgam on another molar tooth. And again, you can see the black lines running like a T through the tooth. Now that crack goes completely through right down into the root. So that allows bacterial debris and active bacteria to go down into the root and eventually damage the root, cause an infection. Tooth is lost due to the mechanical action of amalgam. It expands as it gets old.
So this is taken as read. The profession knows this and still proceeds to use mercury-based fillings. Okay, do keep texting in on 86686, that's 86686, type the word EDGE at the start of your message, leave a space, and that will get through to Melissa. We'll hear more from you after this break. But meanwhile, do not forget that the second hour of this programme is live, online only. You can find that at www.edgemediatv.com. That's www.edgemediatv.com.